Hi, beautiful people. It's Wonderful Wednesday. I'm April Roll, your ER doctor online, and today's video is to highlight Migraine and Headache Awareness Month for this June 2023. So in this video, I'm going to shed light on not all of the different types of headaches, but at least give you some insight and information on some headache conditions that people have that they either may know about or they may not even know about. So the first one that I'm going to start with is migraine, okay? I just want to let you know I do actually have this condition. I live with migraines. Fortunately, I have way less migraines than I used to have when I was a kid. So for migraines, and not everybody's the same, but I just want to put these kind of symptoms out there so that if you are experiencing these symptoms, you can go see a doctor, be evaluated, and not have to live through this type of pain, okay? So in migraines, I'm going to speak from personal experience. I started getting migraines when I was in middle school, okay? And they used to be more of a one-sided headache where there was like a throbbing, severe, pulsating type of pain. And I actually used to get an aura or like a prodrome of symptoms before I got the actual headache, where I wouldn't know how to describe it back then, but something was different, and it would come over me kind of like, okay, what the heck is going on? And then I would feel like this tunnel type of thing coming over my head, and then I would start seeing like blues and aquas, teals, greens, all kind of like almost like a kaleidoscope type of visioning, like I was wearing actual colored glasses, like I'm in a fog. And then a little later, I don't know how much, like 30 minutes, an hour, whatever, I would develop this severe headache. And after a while, I start realizing during that aura, oh no, I'm gonna get a headache, I'm gonna be miserable. And the thing is, with migraines, it can last for a few hours in this severe type of pain, and it can last for 3 days. And sometimes I would actually have the headache for 3 days of just intense pain. Sometimes an Advil or something would make it improve or go away for a few hours, but I would wake up the next day with the same headache, okay? And unfortunately, people who deal with migraines can have these headaches for several days a week, or even several days out of the month, where they're either getting 0 headache-free days or 1 or 2 headache-free days a month. That's probably why you're seeing so many commercials about these new medications being developed for people with migraines, because it's ridiculous, okay? It's severe pain. And one of the things I do, especially when I see someone in the ER who I think may be suffering from migraines, I let them know, start making a headache diary, because when you start to find patterns in your migraine, 2 of the most common ones being dehydration and someone being on their menstrual cycle or about to start their menstrual cycle. Those are 2 of the most common things that I hear associated with migraine. But when you find your pattern, whether it be certain foods that trigger it, certain activities that trigger it, or associated conditions that trigger it, you can basically prevent these headaches. Another couple symptoms with migraines: photophobia, or light worsening your pain; phonophobia, or sound worsening your pain. You can have nausea, vomiting, and even with complex migraines, which can be super scary, and I've had these before too, you can even have stroke-like symptoms like difficulty speaking, weakness, paralysis. Obviously, if this is happening to you, call 911 and go to the ER, get worked up, because you never know. But I'm just saying, migraine can exhibit some stroke-like symptoms. Now, enough about migraine. We're going to talk about some other headache symptoms or conditions, because this is Migraine and Headache Awareness Month. So some other things I'm going to talk about I don't have personal experience with, but trigeminal neuralgia. This literally means trigeminal nerve pain, and that's exactly what causes it. The trigeminal nerve, something's going on with it where it's causing you pain, and a lot of the time people may feel like it's coming from their teeth, or it's coming from their sinuses, or it's coming from their nose, but actually it's coming from the trigeminal nerve. And that is a condition where you should follow up with a neurologist and get evaluation and management for that, because that can be severe pain, you know, like the lightest touch, you know, brushing your teeth, chewing, things like that, just causing so much pain, and that is trigeminal neuralgia. Some other headaches, like cluster headache. These headaches actually, they're further classified. Let me look at this now. Short-lasting unilateral neuralgiform headache attacks with conjunctival injection and tearing. That's one cluster headache condition, SUNCT. And this is a rare form where you have some pain, but you also get, on the one side, you get a very red eye, like burning, throbbing type of pain. And they say it's usually around the eye or temple. And then this has tearing. There's another one though, SUNA, short-lasting unilateral neuralgiform with cranial autonomic symptoms. And this one is similar to the SUNCT, but you're going to either have conjunctival injection, which is a red eye, or tearing, but usually not both. So that is kind of like the two branches of cluster headaches. Another headache form, which again, I'm just recently learning about, is new daily persistent headache. And this, to me, it sounds like basically just an ongoing migraine. And this can actually last for many years. And the reason why I say this sounds like a migraine to me, because I am someone who has migraines, and it says has many of the same features as migraine, including photophobia, phonophobia, nausea, sensitivity to barometric weather changes, and more. I haven't experienced any worsening in my migraine symptoms with barometric pressure changes or weather changes, but that is what is listed for new daily persistent headache, or NDPH, and that's coming from Cleveland Clinic that I'm reading here on this website. Now, like I said, this is not by any means a full list of headache conditions, but again, I want to put it out there for awareness, because a lot of people are suffering from headache conditions, and you don't have to. At least you don't have to suffer as much. There are treatments for these things. Like I said, I don't get migraine headaches that much anymore, because after living with this for so long, since middle school, I have basically, with recognizing the patterns, recognizing triggers, recognizing things that are associated with it, I can actually prevent a good majority of migraines from ever even happening, because I know what to do. Stay hydrated, eat well, and take good care of myself, do good self-care, things like that already have me at a very low for migraines. And then when I do get an aura, which my auras are not even that bad anymore, just like, oh, I feel like I'm going to get a headache, I just take the meds then, because guess what? Abortification, I think that's aborting the headache is much better than trying to stop it once it starts. Because if you have migraines, you already know it's probably not going to work, okay? Like I said, there are a lot of medications out there. Thankfully, I don't have to be on prescription medications for my migraines because over-the-counter meds do work if I abort my migraine before it actually starts. But I'm telling you, if you know, you know. And it's not a good thing to try to catch the headache after it already has started, because chances are you're going to be dealing with that pain for some time before it actually goes away. So if you have headaches, please go see a doctor, because it doesn't have to be this way. You can get some type of relief. If you know someone who has headaches, have them be evaluated, please. If you liked this video, please like this video, subscribe to my channel. I do videos on health topics every Wednesday. So hit that subscribe button so that you don't miss out. Hit that like button, share this video with a friend. If you have any questions about headaches, migraines, anything that I discussed in this video, please leave your questions in the comment section below. If you have any requests for future Wonderful Wednesdays that have anything to do with mental health, physical health, and or wellness, put those topic suggestions in the comment section below, because I do take those into consideration, and I do make videos based on what you guys want to hear as well. But if there is nothing else, I do want to thank you guys for sharing this Wonderful Wednesday with me. Be blessed and stay healthy.